All right, so continue chapter 9 in institutional pharmacy. We are going to pick up where we left off, which was the flow of orders. So when we last talked about the flow of orders, we were talking about the patient information, making sure that we understand patient information consists of the full name, the date of birth, the medical record number, the medical record number, which is one of the primary ways that a patient is identified. You also have the room number, the person's diagnosis, their weight, and then also the drug allergies. So continuing learning about the flow of orders. Um, here's what primarily happens. The orders arrive in the pharmacy around the clock because you never know what time of day a person is going to enter into the hospital, and the central pharmacy is open 365 days out of the year because, again, it is the pharmacy department that dispenses all of the medicine that is going to be in the hospital setting. So it's really important that you have attention to detail as a pharmacy technician to make sure that you are grabbing the correct medication for the correct patient. And also, if you are responsible for the data entry processing, you want to make sure that you're typing the right information. So now that I've talked about the flow of orders, let's next talk about the different types of orders. So there are different types of orders that is going to be in the hospital setting, and it's going to be based on certain words that would be said. So for an example, if there is a medication that is needed stat, S-T-A-T, that means at once. That means immediately, like yesterday, like get it. That's really what it means. So if you hear someone, and you probably have heard that word before, if you've ever watched like a medical show like ER, and they'll say, okay, I need an IV bag in room 221, stat, that means now, immediately, at once. So that order must be delivered within minutes, and that takes precedence over all orders. So if there are 5 medications that's in process, and then a stat order comes in, you stop your processes on what you're doing for everything else, and you start working on that stat order. Now, a ASAP order, and we all know primarily ASAP means as soon as possible, but an ASAP order is not as urgent as stat, but it also should be filled before all other orders. So if you have 2 medicines that have come into the hospital pharmacy and they say, okay, this one is stat, this one is ASAP, which one are you going to fill first?
The stat one.
Yes, you're going to fill the stat one. And then if you still have some other prescriptions that need to be done, but you have an ASAP order that needs to be done, which one are you going to do?
ASAP.
Yes, so you do the ASAP one and then you continue the rest. Now, there are some prescriptions that's known as a standing order, and that standing order is basically like a written protocol that's to be used in specific situations. So, for an example, a standing order might be a person just entered into the hospital, and maybe they just have they're dehydrated, and so a standing order is something that's already written, and then the doctor just has to sign off on it because they already fit a specific situation. So when that order goes to the central field, the central pharmacy, if there is a stat order that needs to be done, an ASAP order that needs to be done, and a standing order, the stat would go first, the ASAP would go next, and then that standing order would follow that. So a standard order could be an already list of medications that's written that the doctor may have, and based on the symptoms that a person may come in with, so they don't have to write a whole prescription. It's already written, and so they could basically like check off a box and be like, okay, for this patient, we're going to just go ahead and get them this particular treatment, using that as an example. Now, you also have another type of order, which is like an emergency situation, and that order is also filled immediately. So some stat orders can be filled quickly using the stock off the shelf, whereas others may require special preparation, such as if something needs to be mixed, like an IV preparation. And we'll be talking about that as we continue to learn in institutional pharmacy. Now, again, for standing orders, if a procedure is to be performed, there's a pre-printed order with the list of medications to be administered if it's already on file for the prescriber to use. And this saves the prescriber from having to write the same order each time the procedure is performed. So that's a standing order. So think of it, and I'm going to write this as an example. So you have a prescription that's an antibiotic, a prescription that's a pain drug, a prescription that's just the IV bag, and then another prescription that's, say, another pain medication. So let's just say this is our standing order. And then I would have a patient's name up here. This is no way what it looks like, but I'm giving you a visual. So patient's name would be up here, and let's just say, based on the symptoms that a person comes in with, the doctor's going to say, okay, we're going to give them that antibiotic. But because it's already written, doctor just has to check off on it and then sends it to the pharmacy department in the hospital so that it can go ahead and be filled. So now that I've gone over some of the different types of orders, stat, ASAP, standing order, and then you have the emergency situations, we're next going to learn about the CPOE, which is abbreviated for Computerized Physician Order Entry. So you have electronic systems that can quickly and clearly transfer the patient orders and the information to and from the pharmacy. Now, this provides an electronic access to medical information, also drug information data, and there's also a limiting errors of transcription. So when medications, or should I say also patient information, is entered into the system that the physician is using, when they translate that information, it's electronically sent to the pharmacy department so that they can receive that as well. And the CPOE helps with reducing medication errors. So different types of medication errors could be, it could be the wrong patient, the wrong drug could be chosen, the wrong strength could be chosen, the wrong time could be chosen. What if they're supposed to take something at 8 a.m. but it's mistaken for 8 p.m. So that matters. And then even the wrong dosage form. What if they're supposed to take what if the patient is supposed to receive something that's supposed to be injected, but instead receive something that they're going to take by mouth? There are two differences when it comes to the route of administration. The route of administration is the way a person is going to take it. So if something is taken by mouth, it primarily takes about 20 to 30 minutes for it to even digest. But when something is entered into the bloodstream, it acts almost immediately. So if someone needs a medication that's supposed to be injected versus something that they're taking by mouth, they're going to feel the effects of that drug immediately, more quicker if it's distributed through injection versus by mouth. So just giving that as an example. So learning more information about the CPOE, those medication orders can be clearly identified, especially if something is selected electronically. And then the computer system checks the new medication against the current medications for interactions or for contraindications. Now, an interaction is something that's going to interact negatively with another medication. A contraindication means it's a drug that should not be used with something else. So when a medication order is entered into the computer system, because it's electronic, it will already have known what's already on the patient's profile, which can also be helpful. Now, healthcare providers can enter all lab results, also dietary requirements, other medications, and they can also enter special notes into the system. Now, the medical record numbers, they are used to identify the patient rather than the address and the phone number, because the address and the phone number identifying the patient is known as their HIPAA, which is private information. So they want to make sure that they always reference a medical record number. And that's why if a person goes to the hospital, they'll usually see like an entire 2 or 3 papers of stickers, so that those stickers can go on each documentation that belongs to the patient. So now that I've gone over the CPOE, we're next going to learn about the barcode point of entry. Now, with the barcode point of entry, each unit of medication has a barcode, and it can be scanned with the handheld device. In our lab, we actually have a a barcode scanner so that the students can get familiar with that. Now, if you've ever been in the hospital setting and seen a loved one be prescribed a medicine or receive a medicine in their hospital room, when the nurses get ready to administer that medication, they'll scan the the bracelet, the medical bracelet on the patient, and then they'll scan the drug, and just to make sure that, okay, this patient is supposed to receive this drug. They do that sometimes. And then also in the hospital setting, they can scan the medication to make sure that it's the right medicine that's also in the system. Now, the nurse is notified of any warnings or of any special notes based on the barcode point of entry, and then orders are sent in real time. So it's the nurse that must verify the order before administering the drug. So information is linked to the pharmacy and the electronic medication administration record system. You should know that's called a EMAR, also known as an EMAR, because MAR stands for Medication Administration Record, and they have electronic ones. And so that medication administration record is proof of when a patient has received a medicine. Now, any discrepancy between the current orders and the medication sent for the patient is detected by the scanner, and then the nurse is alerted to the specific problem. Now, it's the nurse's ability to check on the dosages at the patient's bedside, which helps ensure that the 5 rights of medication safety are followed. Now, you may be thinking, well, what's the 5 rights of medication safety? And I will tell you, I like to think of it as the acronym PTSDR. So P would be, is it the right patient? T would be, is the person taking it at their correct time? S would be, is it the right strength? D would be, is it the right drug? Because there are some drugs that sound alike and look alike. So you always want to make sure that the person is taking the right drug. And then R would be for the right route. So I like to use the 5 rights of medication administration as a acronym, PTSDR. Right patient, right drug, right time, right strength, right route. So those are the 5 rights. So now that we've learned about the barcode point of entry, we are next going to learn about the computerized monitoring of for the adverse drug events, which is abbreviated as ADE, adverse drug events. Now, you have computerized systems that can detect and that can monitor adverse drug events. So if a medicine has been prescribed for a patient and say they are going to another level in the hospital, and the next prescriber is prescribing something else, that computer is going to monitor, and also it can detect the adverse drug events. Now, pharmacies must make sure all medications are barcoded for identification. So when a medicine is chosen from the hospital, it's usually scanned, which is also going to connect with the system to make sure that it's the right drug that's being chosen. And the information in the computer must be accurately and reflect the way the dosage form is to be given. So the dosage form is the form that the medicine comes in. For example, is it a tablet? Is it a capsule? Is it a liquid? Is it a patch? Is it an injection? All of these are different forms that the medicine comes in. So whenever you hear dosage form, that's what you should think of, the form of the drug. Tablet, capsule, liquid, pill, well, I said pill, patch. It could be a topical. Is it an ointment? Is it a cream? It could be something they need to inhale. Is it an inhaler? It could be something that's supposed to be sprayed in the nasal. Is it a nasal spray? It could be something that's an eye drop or an ear drop. So all of these things are different dosage forms. Now, there are ways that an error reporting, published error reporting is a way to prevent future errors, And the computerized adverse drug event monitoring system allows more direct and timely communication between nurses, physicians, and patients. And so, as a pharmacy technician, it's always encouraged that you double check and triple check your work because, again, medication errors are preventable. So, if you need to, check again to make sure it's the right thing. So, now that we get into the last part of Chapter 9, which is institutional pharmacy. Next, we're going to identify some of the responsibilities of an institutional pharmacy technician. You're going to be able to describe the technician's role in the IND, which stands for Investigational New Drug Process. And you're also going to be able to describe the advantages of using an ADS, which is the abbreviation for an automated dispensing system. Also, you should be able to discuss controlled substances and explain the importance of counting, dispensing, and tracking controlled substances. You should be able to explain what a PAR level is and also who's responsible for maintaining them. You should be able to identify the differences between hazardous and non-hazardous IV preparation and explain the importance of aseptic technique for the technician that's preparing a CSP, which stands for compounded sterile preparations. Important information to understand. When IV bags are compounded, that is a CSP, which stands for compounded sterile preparation. And we'll get into more of that as we continue. We'll also be going over things relating to maintaining stock and supplying specialty areas. So you'll be able to identify the duties involved in ordering and maintaining the stock levels of the pharmacy. You should be able to recognize the differences in floor stock depending on the area of the hospital and identify specialty areas of the hospital for which pharmacy stocks or orders medication. You should also be able to describe the importance of ongoing technician education, as well as identify professional organizations that institutional technicians can join. So as we continue to learn about institutional pharmacy, let's next learn about the roles of the institutional pharmacy technician. So there is a flexibility and a need to work all shifts, primarily in hospitals. I'm too still, you guys. Hold on. Apologize about that. Primarily in hospitals, they have 3 shifts: first shift, second shift, third shift. First shift is usually a daytime shift. Second shift is usually an afternoon shift, like 2 to 11. And then third shift is usually overnight. So pharmacy technician must be flexible and must be multifunctional for all of those shifts. Some of the roles of an institutional pharmacy technician is going to include certain settings like the IV room, that's known as the clean room, and the sterile room. That's where the CSPs are created. They also have duties as far as chemotherapy and controlled substances, as well as patient medication. You also have the medication and preparation and inventory. You also have some miscellaneous duties that's performed by the institutional pharmacy technician. And then you have some specialty tasks that include clinical duties and anticoagulant therapy. Anticoagulant is for patients who have thick blood, and so they have to be on anticoagulants, which represents blood thinners. So just to give a visual of what that means. And then you also have another specialty task that a pharmacy technician in an institutional setting can be a part of, and that's preparing nuclear medications. So usually half as many technicians and pharmacists are present on night and weekend shifts, but the patient load is often the same. So now that I've talked about some of the settings in an institutional pharmacy in regards to the IV room and then dealing with chemotherapy and the controlled substances, let's next continue learning about the pharmacy technician's role in the IND, which stands for Investigational New Drug. So if there's a drug that's going to be created, there might be an investigational drug that is going to be in the pharmacy department in the hospital setting, but you also have a technician that can assist with that. And there are some different phases that happens. They have pre-human and human testing phases. When an investigational drug is being created, they have clinical trials. So in those clinical trials, you might have Group A and Group B. Group A might be given the real drug, where Group B might be given a placebo. So that's like a fake version of the drug, and they're going to see how both subjects act in the clinical trial. Now, with the investigational drugs, those go to the central pharmacy. However, the investigational drugs are separated from the other drugs. So they're often used in hospitals, but they're under strict restrictions, and every drug has to have a logbook. So uh, the investigational drug is an agent that's not yet approved by the FDA for use, so it's in clinical trials. Now, those clinical trials must be performed after the drug is approved. Um, but you might be thinking, why might someone want to participate in a clinical trial? Well, the patient may have found that none of the currently available treatments are working, and he or she might want to promote the future development of medication. So they might want to join a medical trial, a clinical trial, excuse me. So the need to know about investigational new drugs, if they are in the hospital setting, they're still going to be in a logbook. Every drug has to have a logbook, but they have to be separated from the other drugs that are real drugs and that are already approved drugs. So those would be separated from the other ones. They would not be amongst the others. So now that I've gone over the IND, we're next going to learn about the patient cassette drawers and or the Pyxis machines, which I'll be getting into that a little bit later. Now, there is a drawer that would basically have that would be used for loading patient cassettes, and it'll come from like a pick station, and that's going to be a long-standing daily task of the hospital pharmacy technician. So say there's a patient that's going to be admitted to the hospital for maybe say 14 to 15 days, that person's going to have daily medications that they're supposed to be taking. And so the hospital pharmacy technician would be responsible for loading that patient cassette with the medications that they're supposed to be taking. Now, the medications needed for the next day must be loaded into the cassette drawer. So in the hospital pharmacy, they have an automated floor dispensing system, and they usually have two different systems. One could either be a Pyxis or a SureMed. Those are the names of the systems. And so tomorrow, in the next lecture, I'm going to show you an example of what an automated dispensing system looks like, so you can get a visual of that. Now, with the patient cassette drawers, those are held in large push carts so that they may be delivered to each floor each day. Now, there is also a robot dispensing machine, and this helps by this fills each patient's medication cassette with 99% accuracy as the cassette moves along a conveyor belt. And then it speeds up the delivery of the medication, and it also helps ensure the accuracy. Now, accuracy is greatly increased with automation in hospitals, but most medications are provided this way. So you will have some cases where the medicines might be provided manually or by this dispensing machine. Now, an automated dispensing system, an example of that would be the Pyxis Med Station. A Pyxis machine is very large, and it holds a lot of the medications. And in order to make a medicine, they would use a fingerprint scanner for verification, and then they would also have the touch screen for medication removal. So what happens is, once something is entered into the system, the drawer will open so that the technician can remove the drug, and then it will close, and then the machine will record that medicine was taken from the Pyxis machine. So there are many similar automated dispensing systems similar to the Pyxis machine that relies on passwords or identifications, or even swipe cards to control the access. So this is just one of the examples of what would be in a large pharmacy, so that if they need a certain quantity, they would put in that quantity, and then they would pull that drawer. They would pull the drawer open so that they can remove the medicine, so that it's easier for them to fill the prescription for the patient. Now, with unit dose medications, those are an important daily task of a pharmacy technician, and those help by preparing the unit of dose medications that's not available from the manufacturer, or it might not be stocked by the pharmacy. Now, it's the pharmacist that performs the final check of the unit dose medication, and so there are various ways how a unit dose medication might come. One example could be it could come in a blister card, and so the blister card might be something that looks like this, and then it would hold the medicine that the patient needs, and this is so it could be easier for the nurse to either poke out the medicine so that it's easier for the patient. Another example of a unit dose would be if it's already individually packaged. So like I have this example, say the patient just needs 6 pills. So it's 2, 4, 6. If this is what is needed, this would be given to the patient, and then it would be labeled in like in their drawer or in a Ziploc bag, and then the nursing floor would dispense this to the patient. And if something has been changed and this needs to come back to the pharmacy, then it's never been tampered with because it's still in unit dose packaging, and then it can be given again. But just using that as an example of a unit dose medication. Now, for unit dose liquids, the TJC, which is the Joint Commission, they now require that hospitals make all medications patient dose specific. So that means if there is a medicine that a patient needs, say 20 milliliters, then based on the directions, the technician, the pharmacy technician, can actually prepare the unit dose oral syringe. And I'm going to give you an example of what that looks like. So based on the oral syringe, the pharmacy technician, so say it was 20 milliliters, the pharmacy technician would get the liquid bottle that the patient is supposed to have, and then would draw up the correct amount that's needed, and then place a labeling on the oral syringe so that it can be administered to the patient. Now, every liquid dose is prepared in a unit dose package and is also labeled, as I just mentioned. So now that we've talked about the unit dose medications, we're next going to talk about controlled substances. So with controlled substances, you have controlled substances are medicines that are restricted in regards to even a certain quantity. There are certain requirements that has to be on a prescription, and it's narcotics. So there is special requirements in regards to counting, dispensing, and also tracking the narcotics because it is a critical job. Now, each hospital conducts an annual count of controlled substances by 2 nurses every single shift. And this is to make sure that no medicines have been tampered with or have been taken. Now, all controlled substances are counted 3 times daily. Now, there is a PAR level, PAR standing for periodic automatic replenishment, and the PAR level basically means it's the amount of medication that's kept on the floor at all times. So let me give you an example of what PAR level means. So say at your house you might have toothpaste, and you might go through toothpaste, a tube of toothpaste once. One tube of toothpaste can last you for 2 weeks. So how many tubes of toothpaste would you need for the month?
Or
If one tube lasts if one tube, let me re-ask again. If one tube of toothpaste lasts you for 2 weeks and you need toothpaste for a month, how many would you need?
Oh, two.
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 So let's just so
I thought you said
for it's okay.
every
So
time.
for the par level, let's say you always want to have two on hand. So let's say same thing in the pharmacy. Their par level for a medicine might be, okay, I'm going to use the drug ibuprofen, 800 milligrams. In the hospital pharmacy, they might say, okay, we always want to have 500 pills of ibuprofen, 800 milligrams. When it gets down to, say they have 600 in stock right now, they don't have to order anymore right now because they're still above their par level. But let's say they get to 495, they're going to order more because they're now below their par level. So par level is just like that. It's the amount that you always want to keep. So I wanted to give you a visual of what you would do at your house and then give you a visual of what it looks like in the pharmacy setting. Now with controlled substances, those are kept in a locked store. Those are kept in a locked room in the pharmacy at all times. So even in our classroom, in our lab, I have a key to our C2 cabinet, as I like to call it, so that you can see what that looks like. Now you might ask, why are narcotics so tightly controlled? Well, narcotics are highly addictive and they can lead to heart or respiratory failure. They are also frequently filtered by the staff members. So it's the technician that assesses how many controlled substances are needed to keep each unit to its par level. So in your lab today that I have assigned already, in your workbook, you are going to learn how to do par levels, and I will show you that at the end of this lecture. So continuing learning about controlled substances, after confirmation of the daily narcotic count, the technician signs out of each drug onto a dispensing sheet, which is also used to deliver the medications. And the controlled substance must be kept unidentifiable drug delivery. So those might be placed in a stapled brown bag, and the technician should never let these out of sight. Now, all controlled substances must be countersigned off on the pharmacy inventory sheet by the pharmacist after they have signed into a department. So once the controlled substances are provided to the pharmacy department, the pharmacist keeps a log of that. So continuing to learn about controlled substances, there's always a counting of the narcotics that's done by the nurse and the technician. So if it's the pharmacy technician that's delivering the narcotics to a nursing floor, the nurse is going to sign off that they've received it, and the technician is going to sign off on how much was given. So if they say, okay, 5 pills is given to this patient, the nurse is going to sign off, yep, I'm signing for 5 pills. And the technician is also going to initial that, yep, it's 5 pills. So if any controlled substances are going to be returned, it's going to be validated in the pharmacy. Now, registered nurses, not LPNs, which stands for the licensed practical nurse, it's the registered nurse that must sign for the controlled substance if it's being brought up to by the pharmacy technician. And it's always important to make sure that all numbers are correct. Now, who besides, let's see what you've been learning so far. Now, who besides a registered nurse can sign controlled substances into a department?
The pharmacist?
Okay, so let me rephrase it just a little bit. When the medication is provided from the pharmacy department to the nursing floor, which is another department, besides the registered nurses, who can also sign off on the controlled substances?
The technicians as well, you said, right?
Technicians. So It is going from the pharmacy department to the nursing floor. And once the registered nurse receives the count of the controlled substance, then the technician can also initial that that has been provided.
So it's like you have to double
Mm-hmm.
your both.
It's always going to be 2 signatures.
There you go. So pharmacists and technicians as well. So the pharmacist signed for like let's say what you said,
So
5 pills, and then the
So
pharmacist-
double count and double sign.
Yes.
Okay.
But in the pharmacy department, it's the pharmacist who receives the controlled substance if it was delivered. Say they needed to reorder the controlled substances. Well, the pharmacist is going to keep a log of that and is going to sign for that, because that's where the controlled substances are even going to be first given to. Now, when the medicine is prepared and it needs to go to the nursing floor, the pharmacist doesn't leave the pharmacy to deliver anything to the nursing station. It's the pharmacy technician that does that.
Ms. Redding, is that
Yeah.
only for the controlled substances or
That's all, like the, oh, you
all
mean
medications?
which part that something needs to be signed off on?
Yeah, the both signatures.
Mm-mm. Controlled substances have to be signed with both signatures, but it's also the pharmacy technician that can deliver the regular drugs to the nursing floor as well.
I got you. Thank you.
Absolutely. So now that we've talked about controlled substances, we've learned about automated dispensing systems. Let's next get into the IV preparations. It's important to know that IV stands for intravenous. And so to prepare an IV bag, there's always going to be a printing of the IV label. And then they always have to keep up with the changes in the patient status, because what happens if the prescriber changes something and then something now is newly created? So they'll always want to keep up with that information. There also might be reconstituting and preparing all IV medications in a horizontal flow hood. Reconstituting is adding liquid to a powder form, but also preparing IV medicines are done in the horizontal flow hood. Now you might be thinking, well, what's a horizontal flow hood? What does that mean and what does that represent? Well, the CSPs, the compounded sterile preparations, that medicine has to be performed in a LAFW, which stands for laminar airflow workbench. It's in a horizontal flow hood. Horizontal, think of the H. This is how I remember the difference between horizontal and vertical. Horizontal means across. Vertical, if you actually write a V, I'm visual, don't judge me, y'all. Vertical starts with V, so V means it's going down. So vertical means that it's going down, and horizontal means across. That's literally how I remember it. Some people may say, think of horizontal as in the horizon. The horizon is across. Giving another visual. But in a horizontal flow hood, in that flow hood, air is going to blow. And the reason why air is blowing is to keep particles off of the items so that there is no contamination. Because we don't want contamination on anything that's going to go directly into the patient, because that's going to cause pathogens and problems, and we don't want any of that. So all IVs are prepared in a sterile place. That way, again, the whole purpose of it is to keep down contamination. So the IV is prepared and then it's delivered. Then there's a delivery of the medications to the nursing floor. So you might be thinking, as I kind of mentioned, what is reconstitution? I kind of gave my version of it. Reconstitution is where you're going to have liquid added to a powder, but the professional term of reconstitution is adding diluent to a powdered drug to make a final product. So think of it as Kool-Aid. Kool-Aid would be the powder, the water would be the diluent, and when you add them together, you get a nice flavored drink. And that would be the final product. So just giving a visual on that. So now that we've gone a little bit over the IV preparation, and when we get ready to learn about aseptic technique and how to actually make an IV, we'll get more into how the IVs are prepared step by step. But for now, we're going to learn about aseptic technique. So aseptic technique is the method that's used to prevent contamination of an object by microorganisms. It's extremely important into the preparation of all IV medications, chemotherapy, and ophthalmics. And this is because we want to be free from pathogens. So there are samples that are periodically tested for microbial contamination. So there is something called a petri dish, which is where the person would touch the petri dish after performing aseptic technique and hand washing to make sure that there is no bacteria on their hands and to make sure that they also practice aseptic technique correctly. Now, all technicians are periodically tested on their knowledge and their ability to perform the proper procedures for aseptic technique. Now, you as a pharmacy technician will be given information and training on how to do proper hand washing as it pertains to aseptic technique. So now that we've talked about aseptic technique, let's next talk about the non-hazardous IV preparation. So parenteral medications are meant for quick action. You should know parenteral medications are anything that's going to be injected. So parenteral, anytime I hear parenteral, I think of punctured skin. It's just what I think of. So parenteral medications are the following 5: intravenous, intrathecal. Intrathecal means it's going to be inserted in the back, into the spine. So like a epidural is given intrathecally. Just giving you a visual of that. Intravenous is going to be into the vein. Intradermal is going to be into the skin. Intramuscular is going to be inserted into the muscle, and then subcutaneous is going to be under the layer of the skin. So you have the 5 parenteral routes: intrathecal, intradermal, intravenous, subcutaneous, and intramuscular. Did I repeat one or did I say it all? I think I said it all. IT, ID, IM, IV, subQ. Those are the abbreviations for the 5 parenteral routes that I just provided. So parenteral means it's going to be injected, so it's meant for quick action. So anything that's injected is going to work fast. So you always want to make sure that when we are selecting a medication that's going to be injected, you want to double check, triple check, because once it's injected, there's no way to retrieve that, like it's into the person. So I always want to make sure. Now, there are some IV preparations that must be prepared with additives. These means that things are going to be added to it. Now, those things must still be prepared in a laminar flow hood, like the vertical flow hood that I mentioned earlier. The flow hood is going to be inside the clean room, also known as the IV room, and those are going to be, those are prepared in the laminar flow hood in a clean room. Now, nurses on the floor maintain a stock of pre-made large volume bags. A large volume bag is a IV bag that might be 500 milliliters or 1,000 milliliters. And those bags can be supplied by the central supply or by the pharmacy. Now, the clean rooms, they buffer the IV admixture room, and they allow for preparation of the IV labels and the stock to be maintained in a clean yet separate area. So you have the clean room, which is where the sterile compounding is prepared. And I will give you guys a visual of what that looks like in the upcoming lectures. So now that we've talked about the non-hazardous IV preparation, let's next learn about some organizations that has to do with the sterile compounding. So the USP, which stands for the United States Pharmacopeia, they are the agency that sets the regulations and the standards on compounding materials. So the enforceable USP regulations for facilities that prepare sterile products, they are responsible for both the non-hazardous and the hazardous. Now, you might hear me keep talking about hazardous, and you might get thinking, so what's the difference? What's the hazardous? Well, the hazardous are going to be an example as chemotherapy drugs. Now, compounding must be done only in a clean room that has an ISO standing for International Standard Organization. So the compounding for the sterile products must be done in a clean room that has a Class 8 ISO or better. So Class 8 is the standard. There are also glove box isolators that can be added. A glove box isolator is think of a box and you can put your hands in gloves and then you can prepare the IVs. I will try my best to find a video that has a glove box isolator so you can get the visual of that. So sterile compounding came under federal regulation in 2004 with the publication of the USP guidelines, and those guidelines for sterile preparation are better known as USP Chapter 797. So need to know, there are 3 USP guidelines that has to do with compounding. You have USP 795 for non-sterile compounding. That's your compounding where you can mix creams, ointments, liquids. That could be non-sterile. You don't have to be in a clean room in order to perform that. Then you have the USP 797. That is where sterile compounding guidelines are. And then you have the USP 800, and that is for hazardous compounding. So you have 3 different USP guidelines. USP 795, which is for non-sterile compounding, USP 797, which is for sterile compounding, and then USP 800, which is for hazardous compounding. So now that I've gone over the regulations and standards of USP in regards to compounding, you're next going to learn about IV therapy and chemotherapy preparation. So it's the technician who is responsible for preparation of IV therapies and chemotherapies. There is 2 different flow hoods where IVs can be prepared. Need to know. The 2 different flow hoods, or shortly known as the 2 different hoods, and we're referring to equipment, is the horizontal flow hood, and then you have a vertical flow hood. Now, the horizontal flow hood is used to prepare IV medications. Those are non-hazardous, just so you remember the differences. And the horizontal flow hood is going to be used is blowing air towards the item so that there is no block of air. And I will again show you what that means. But horizontal is used to prepare IV medications. Now the vertical flow hood is used to prepare chemotherapy drugs. And so when a chemotherapy drug is prepared, a technician must double garb, and garbing represents using personal protective equipment such as gloves, gowns, shoe covers, hair bonnets, even goggles. So the technician must wear 2 gowns, must wear double gloves so that the chemotherapy is not exposed at all and won't harm the person. So which flow hood, let's do a questionnaire, which flow hood should chemotherapy drugs be used? Is it vertical or horizontal?
Vertical?
Mm-hmm.
Vertical.
Vertical. The vertical flow hood is used to prepare chemotherapy drugs. Now, if the person is creating chemotherapy drugs, their hands must not move over any of the vials. And let me give you an example of that. So say we have a medicine vial. This is full of water. There are no real drugs in our lab room. But remember, vertical, that flow hood, the flow is of air. There's a flow of air. Which way is that air going to move if you're in a vertical hood? Is it going to flow across or down? Let me give the example again. A horizontal flow hood means the air is going to flow across. That means the air is flowing towards you. And the best way I can remember that is I literally think of the letter H. H is across. H is across. So if there is air, the air is flowing across. That means it's flowing towards you. If you are in a vertical flow hood, I think of the letter V. And V, when you write the letter V, you have to go down, a line down and a line down. So the vertical air is going to flow down. Vertical air in a flow hood flows down. So if a person is using chemotherapy drugs and they are preparing that chemotherapy drug in a vertical flow hood, they cannot block. The hands must not cover the top of the vial because air has to constantly be flowing down on the vial so that there is no contamination. Because once the needle goes inside of the vial, if there has been any contamination, then that's going to be in the patient. So just giving you a visual of that. And I'll give you more visuals as we continue to learn about IV therapy, but I wanted to give you the real close visual of horizontal and vertical. So now that we've learned about the IV therapy and chemotherapy preparation, we're next going to learn about labeling. So with the labeling, there's a proper placement of labels that ensures the visibility of the solution and the contents. So basically, when something is labeled, it should not cover the most important information. Now, the technician must initial all medications that's being prepared, and it's the pharmacist that checks each prepared medication before it gets delivered to the floor. So if a medicine has been prepared by the pharmacy technician, before this goes to the nursing floor, it's going to be the pharmacist that's going to do a final check. And the pharmacist is going to check the use of light protected bags for light sensitive drugs. They're going to check the medication that has to be refrigerated. They're going to check the storage requirements, and they're going to also check the medication stability. So it's also the pharmacist that must countersign, and they can verify by initialing all of the medications. So a technician who's prepared it is going to initial, and then the pharmacist that checked it is going to initial as well. And a technician must also know the drug requirements, which are not indicated on the labels. They got to make sure if something has to be refrigerated, it should stay in the refrigerator. Or if something needs to be room temperature, they're going to always check the room requirements as well. And then anything that is prepared using sterile preparation or anything that's compounded from the pharmacy is going to use what's called a beyond use date. So the beyond use date is for compounded preparations that's made by the pharmacy. An expiration date is made from the manufacturers. So now that we've talked about labeling, we're lastly going to talk about maintaining stock and supplying specialty areas. So with the floor stock, there are supplies that must always be kept on hand in units. And the pharmacies supply the special pre-printed forms with a description of the commonly used drugs for specialty areas. Now, any medication that's outdated, those must be checked monthly. And then outdated medications are returned to the pharmacy if they expire within 3 months. And the reason why is because the manufacturer will give credit to the pharmacy. So my lights go out because I'm being real still. And I don't know how, because I feel like I'm moving. So if something is expired in the pharmacy department, as far as medications or supplies, the shelves are always checked, especially monthly, to make sure that medications that are going out of date are taken off of the shelf, especially if they're within 3 months of expiring, so they can be returned to the manufacturer. Now, there's an outside company that's contracted to do drug inventory on expired medications. So the pharmacy normally will receive the floor stock orders from the specialty areas on a daily basis. So there are floors in the hospital that keep a normal stock of medicines on a day-to-day basis. And then if they need more, because they're checking their floor stock, they're going to send a floor stock form to the pharmacy department so that the pharmacy can refill their orders. Now, expired medications can also be destroyed by an independent company. So that's something that goes on outside of the pharmacy department. Now, with the floor stock by department, you have different floors that's stocked. So one of the floors that's stocked is the OR, which stands for the operating room. And then you also have the PACU, which stands for the post anesthesia care unit. So those floors are stocked. They stock the wards in the clinics, and they're stocked with their own type of medications. You have the emergency department, which is abbreviated as the ED, the OR or the ICU, intensive care unit. That's what ICU stands for. That's those departments. The stock has many drugs that's in injectable forms, and they also have oral and injectable controlled substances. So it's the oncology department that is the main specialty area that stocks chemotherapy drugs. Oncology means the study of tumors, cancerous tumors. So oncology primarily holds the stocking of the chemotherapy drugs, and then you have the other different departments. Continuing learning about other floor departments, other floor stock that's by departments is you have pediatrics, and that particular department has medications in lower doses and also in suspension form. Suspension form is going to be a liquid because most of the pediatrics can't take a pill. Labor and delivery, that abbreviation is L&D. The labor and delivery floor, they usually hold injectables that's meant for labor, contractions, and cesarean births. So they always have like a cart full of medicine. And then if they need to be restocked, then they're going to send that cart to the pharmacy department. The pharmacy department is going to restock it, and then going to send it back to that floor. Now, it's the technician that collects and fills all floor stock medications. And then you have a technician that can fill and stock the crash carts or the OR trays or the boxes or the carts. And so with the trays, they have specialty medications that's prepared ahead of time for the operating room, or the emergency boxes that's used by EMS, or crash carts. So all of that stuff is filled by the pharmacy department that a pharmacy technician helps create. And then you also have the other floor stock, like the central supply. So all of these things, it's a lot of moving parts, but a pharmacy technician can assist in all of these floors and responsible for filling them up. Now, there are some specialty departments that are stocked by the pharmacy. So the other ones you saw, the floor stocks those things, but it's the pharmacy technician that fills those carts up. Now, there are some special departments that stock primarily by the pharmacy. Those special departments are the anesthesia, respiratory, the injection clinic, and then also radiology. Now, the physicians or a nurse anesthesiologist can administer the medication used before and throughout surgery. For therapists, they administer breathing treatments to hospitalized or to clinic patients. And then the nurse administers adult and pediatric immunizations, and they can also perform allergy skin tests. And it's the technician that administers the dyes for imaging, and they may use a medication card to do that for the radiology department, just to give you some basics of that. And then lastly, we're going to talk about the future for institutional pharmacy technicians. There are organizations that have memberships available for pharmacy technicians that work in institutional settings. One example is ASHP, which stands for American Society of Health System Pharmacists. So they also have a technician membership. You have other organizations that have memberships for pharmacy technicians outside of just institutional, but some of those would include APHA, which stands for American Pharmacists Association, and they also have a technician membership as well. So this is actually going to conclude our Chapter 9 lecture on institutional pharmacy. where we've learned about flow orders. We've learned about the different type of orders that can be called in, like STAT, ASAP, standing orders, and also we learned about the automatic dispensing systems. We've learned about the different roles that a pharmacy technician can have in an institutional setting. We learned about who has to check off things. And so this is going to conclude our lecture on Chapter 9 with institutional pharmacy.